Okay, now I'll start the session. So, a very good afternoon to all who have joined us this afternoon. On behalf of the Optometry Confederation of India, I warmly welcome you all to today's special webinar on ocular manifestations of PCOS. This session is organized on observance of Women's Eye Health Month for this April. Women's health and eye care are closely interconnected, and conditions like polycystic ovary syndrome, that is PCOS, have significant but yet often overlooked ocular implications. This session aims to enhance our understanding of how systemic hormonal imbalances can impact ocular health, enabling us, eye care professionals, to provide more holistic and informed patient care. We are delighted to have with us today our esteemed speaker, Mumtaz Qazi, faculty at Lotus College of Optometry. She is a dedicated academician and clinician with strong expertise in comprehensive eye examinations and a keen interest in ocular surface and systemic associations with health. Through her work in teaching and clinical practice, she has contributed to training future optometrists and promoting evidence-based eye care. We are confident that today's session will provide valuable clinical insights and practical takeaways for all the participants. So without any further ado, welcome, ma'am, and I hand over the session to you.
Thank you, Shweta, for such a nice intro. I'll just share my screen. Okay, is it visible on the slide mode?
It's in the presentation. It's loading.
Now?
Yes, perfect.
Perfect, okay. So good afternoon, everyone. As Shweta said, I'm a faculty at Lotus College of Optometry, and today we are going to discuss one of our research paper, ocular manifestation of polycystic ovarian syndrome. So before we start, what is the meaning of a healthy woman? Okay, so depend on a research question, the healthy woman mean who has something called as natural menstrual cycle without any delay, regular, and there is no facial hair or there is no observable symptoms on the face, or if they are doing any kind of sonography and everything, the reports are quite normal. There is no cyst, there is no thickening and everything. But vice versa, when we talk about PCOS, so as you all are aware, PCOS is an endocrine disorder. Okay, and the prevalence, if you see, is not very small. It is approximately 8 to 12%, which is quite high. And if you see, because of a lifestyle now where the new generation is going towards, this prevalence is going on increasing day by day. So how we diagnose this PCOS and everything? So there are three basic criteria which we will discuss later in the presentation, but there are three things which we have to look for. There's something called as hyperandrogenism. So what do you mean by this hyperandrogenism? Okay, so in this case, there is a elevated androgen levels, okay, such as you will see hirsutism. So what does it mean? So you will see unwanted facial hair on the girl face or a woman face. Okay, there will be a lot of acne. At the same time, androgenic alopecia will be there. Similarly, if you see the ovulatory function, it will be, of course, it will not work fine. There will be irregular or absent of ovulation, which can cause menstrual irregularities or in future infertility. And the most and the foremost important thing, the ultrasound. The ultrasound reveals everything. The person who is suffering from PCOS, if we do a ultrasound, we will see a enlarged ovaries with multiple small follicles and everything. So how do we calculate? For our research, there are two criteria, NIH criteria and Rotterdam. For our research, we have used the Rotterdam criteria, which most of the gynecologists now prefer to diagnose PCOS. The same thing, hyperandrogenism will be present. This you can get it from the patient's observation or maybe a history and everything. There will be an ovulation, maybe a loss of your menstrual cycle and everything. And then if you do see a sonography report, there will be polycystic ovaries, and where they said that more than 12 follicles will be present, approximately 2 to 9 mm in size. So before we start with our research, first we have to talk to you about what the literature says. So we have divided this literature into three parts. We have seen what the PCOS, if a person is suffering from PCOS, then is there any effect on the tear film? Then the next we have seen the same thing on the anterior segment and then the posterior segment. So as you can see here, we have three different literature review, but the last one, the meta-analysis, which says that yes, the tear film do get affected in PCOS group. If you see here, they have done a systemic analysis where they have included the studies which was assessing OSDI score, the ocular surface disease index, the tear breakup time, Shermer's, and the meibomian gland dysfunction. And they have said KS in PCOS group, there is a significant association with the dry eye. Similarly, if you see the topmost two, three your literature review, it again says if the person who is involved with PCOS, their TBUT is significantly lower as compared to the normal group. So these were all two was case control studies where they have compared the parameters with one with the PCOS group and other with the case control or age match normal group. The second, the literature which we say, it's talking about the anterior segment. The anterior segment is very vast. It starts from your, you can say, if we just exclude your tear film, your corneal parameters, which include your central corneal thickness, which include your topography, your anterior chamber depth, and your lens thickness. So there are three studies which says, one of the study which was evaluating the corneal topography and densitometry. Again, they have done a cross-sectional comparative study in a PCOS and the healthy object, and where they have compared the pentacam reading for both the groups. And they showed yes, in PCOS group, there was an increased corneal thickness. At the same time, there is a altered corneal densitometry values. Then the next study, which evaluate the anterior segment finding in women with PCOS, again, it is a comparative study where they have assessed IOP, central corneal thickness, and anterior chamber depth. And the result says, yes, the central corneal thickness was relatively higher in PCOS group as compared to the normal group. Now, if to go further, the literature says for the posterior segment. So here is the thing. See, we normally say yes, in the other studies for the tear film, we find out yes, the dry is quite common and it affects the multiple component of your dryness of the tear film. In anterior segment also, it says yes, we do see a, you can say, a increased corneal thickness. But when we talk about posterior segment, so they have done a retinal and optic disc microvascularization in PCOS, and they have found out that there is a significant alteration in retinal and optic disc density in PCOS group as compared to the age match normal. So which says that PCOS may affect retinal microvascular circulation due to hormonal or metabolic changes. At the same time, the another study done by Shiromani et al., they have done a case control study which say increased RNFL thickness and altered macular thickness observed in the PCOS group. So in PCOS, we tend to see a RNFL increased thickness. So on the basis of this, we have found out that yes, there are multiple studies on the tear film has been done on the, but the reportings are little inconsistent and inconclusive. That is why we have gone to a aim to evaluate ocular manifestation in women diagnosed with PCOS, because in the previous study the sample size were different, the sample was, they have not considered the overall ocular manifestation. So here we thought of doing a, on the same patient we thought of doing a multiple test and then to compare it with the age match normal. So the objective was to evaluate tear film status, to assess the anterior segment parameters, and to evaluate the posterior segment changes, and then overall compare the finding with the age match healthy controls. So this was a comparative cross-sectional study where we have included women within the age group of 18 to 45 years. It was done in Mumbai at Lotus Eye Hospital. Okay, on the basis of Rotterdam criteria, we have divided the patient into PCOS group and the age-matched healthy controls. So this you can see. Okay, the suppose now we are doing a research on tear film analysis. So we have excluded patients who are tend to use a contact lens because you all know that contact lens are the main features which can give rise to a dry eye. Similarly, any person who was having any history of ocular trauma, any surgery, frequent smoking or alcohol consumption, this all participant we have excluded from the study. And of course, we have taken the written and oral consent from the patient to do participate in the study. So this is the methodology which we have followed. Okay, after taking the written consent and everything, we have taken the ethical approval also from the institution ethical board. After we have enrolled the patient, every patient, whether it is a PCOS group or whether it is a normal healthy controls, we have done a basic preliminary examination which will include your history, and history include everything: the ocular history, the systemic history, family history. If any one point we have understood that this is going to affect the parameters which we are going to measure, we have excluded those patients. The BMI and the basic workup like your visual acuity, refraction, and your slit lamp examination. After we have enrolled the patient, we have divided them into case group and the control group. Okay, and then for the tear film assessment, we have done OSTI score, which they can fill, the Shermer's 1 and 2 test, the non-invasive tear breakup time, the tear meniscus site, and myography. Then for the anterior segment, we have measured central corneal thickness, anterior chamber depth, lens thickness, corneal curvature, and the corneal sensitivity. For the posterior segment, we have done with the help of your spectral domain OCT, where we have measured the retinal nerve fiber layer thickness, macular thickness, as well as the CD ratio. After we have collected all the data and everything, we have converted into an Excel form, and then we have used SPSS for the statistical analysis. And then overall, we wanted to see okay, what is the ocular manifestation in PCOS. So overall, 96 women participated in the study, 48 each group with a mean age of 24.96 in the case group and 24.15 in the control group. So as you can see, we have, as much as we could try, we have kept the same similar groups in both the studies. So here are the few results. If you can see here, overall the OSJ score. So the control group was showing the OSJ score, which was much lesser as compared to the PCOS group. So yes, symptomatically also PCOS group found that yes, they could have dry eye or they are feeling some discomfort in the eye due to tears, and which was significant. If you see here, it was a less than 0.05, which shows that there is a significant difference in the OSJ score. At the same time, Shermer 1, Shermer 2, and the non-invasive tear breakup time and interferometry, tear meniscus side. This all reading, if you see, they are on the higher side, which indicate yes, PCOS has the effect on tears and dryness, which is a very well-known phenomena, which we also find in our study also. Whereas if we compare the microscopy score, the previous research says okay, there was a significant difference. We do found a clinical difference, but when we did a statistical analysis, we found there was no significant difference between the microscopy score. Now, the next, when we talk about the anterior segment of the eye, where we have measured the central corneal thickness, and we found okay, yes, the significant increase in the corneal thickness in the PCOS group. At the same time, the increase in the lens thickness as well as in the NDA chamber depth and the corneal sensitivity and IOP shows no significant difference. But there was a slight difference clinically, if you say, yes, there was a slight difference, but no statistical difference. And when we are talking about this increased corneal thickness and lens thickness, we can say it could be due to the resistance in the metabolic waste to go out of the body. They are increasing the fluid intake and everything. When we talk about the posterior segment, so in posterior segment, overall, if you see, there was a significant difference in the retinal nerve fiber layer thickness. And when we found out the average thickness of retinal fiber layer thickness also, they found yes, in PCOS group, it is the thickness are showing much higher, which according to us, we thought okay, it is a good phenomena. Okay, because we all want the retinal life fiber layer to be thickened as compared to, because we don't want anybody to go for the glaucoma, because as you all are aware, as the patient develop glaucoma, the retinal nerve fiber layer thickness go on decreasing. If you see the cup disc ratio, overall it was showing no significant difference. So this was our result. So on the basis of this, what we can suggest, yes, the present study demonstrates significant tear film alteration in PCOS, which of course align with the previous study where they have done, some studies have done only NIBUT, some studies have done only OSDI, but here because we have done a comprehensive tear film evaluation, we can say that there was a tear instability as well as the increased dry eye symptom. Means both the functional and the structural tear film changes were seen in the tear film assessment group. At the same time, the NTA segment, there was an increased central corneal thickness, but there was no change in the IOP and the AC NTHM depth, which was consistent with the literature of review of the previous studies also. And in the posterior segment, it shows the increased RNFL thickness. So, of course, it is influenced by the hormonal and the metabolic factors. So, what we can interpret from the result and discussion, yes, tear film discussion is totally present, more of functional as compared to purely structural. So, as we have seen in the research result, in micrography, we were not going to see any kind of significant statistical difference. But if you have seen the OSDI score, the Shermer's, the NIBUT, we were seeing the functional score was much on the higher side. Similarly, the corneal structures were alternating as compared to the control group, and there was a retinal nerve fiber thickness increment, which shows that retina is also getting improved. So these ocular changes are basically a hormonal imbalance, or maybe you can say it is due to the insulin resistance, or maybe chronic low-grade inflammation is present in the PCOS group. So on the basis of our findings and everything, what we want to recommend, yes, a woman, if you encounter any girl or any woman who is suffering from PCOS, PCOD, or any different, like you can say menopause, premenopause, and everything, they have to go under a routine eye examination on timely basis, because it is very important to understand all this. Suppose your patient, you understood कि yes, PCOS is going to affect your tears. So if the same person is going to wear a contact lens in future, so you can recommend a good quality contact lenses, or maybe you can customize the contact lenses for them. So the routine ophthalmic screening is very important. At the same time, we can have a multidisciplinary approach, a gynecologist, endocrinologist, or a eye care practitioner, maybe if an ophthalmologist or an optometrist can work together to create awareness among all these patients so that they can go for early screening, because as you know, early screening, timely management, and collaborative care can lead to better ocular and overall health system. So on this note, I would like to conclude that PCOS is not only an endocrine disorder, but if you talk about the ophthalmic part, it does affect your overall health of your eye, which says the person who is suffering from PCOS, they should undergo a proper comprehensive eye examination on a timely manner. Okay, these are the references. Thank you.
Thank you, ma'am, for that insightful session. I'm sure, a lot of people would have got more information about the condition and its ocular implications. So we'll start taking questions. First question is from Sakina. How can an optometrist refer a patient for PCOS based on only the ocular findings?
Okay, it's a very good question, Sakina, because most of the students who are hearing this, suppose, as I already mentioned during my presentation as well, suppose in an OPD, when we ask patient about the ocular history and when we talk about the systemic history, because here we don't just follow the what is the complaint, but when we talk about ocular history and systemic history, we understand that yes, patient is having taking some kind of medicine, or maybe patient is suffering from, maybe patient will say कि when we work a lot on computers, my I feel dry, or I don't want to look at the computer, or when I, especially the young woman who is wearing contact lenses as well as suffering from this condition. So, and when you observe the patient, suppose you see something called as abnormal facial hair or something, then the observation plays a very important. And by seeing all this line, you can tell your patient to go and visit the gynecologist or the endocrinologist, so that you will, and you can give a note कि yes, this patient has come to our clinic and we have observed all this finding. Kindly rule out this patient for the uh, PCOS. So on the basis of the history, because in optometry or in I can say in healthcare world, the history plays a very important role. I suggest if you take a proper history, your 50% case is solved. Okay, and then you can do a proper referral. The multidisciplinary approach is very important. So you can refer this patient to a gynecologist and say, "Okay, I have observed this thing," and then they can do a person. Similarly, if you are seeing any kind of see, suddenly your patient was coming to you since many years, maybe, and suddenly you are seeing increase in corneal thickness. Okay, initially it was 550, now it is coming 570, 580. So you have to track your patient and say, ki, yes, there is, and there is no signs of any other ocular manifestation, maybe no keratoconus, nothing else, no steepening. Then you can easily refer this patient for the further evaluation.
Thank you, ma'am. So just in continuation with Sakina's question, I wanted to ask, like you said that once we find, the specific signs, we ask them to go get themselves diagnosed if there is PCOS or anything. I wanted to know, do you think it is important for us to, add it in the history, in general history part, like when just like how we ask whether you have sugar, BP, something like that. Should we
Yes.
also include PCOS like for women in particular age groups?
Yes, yes. See, PCOS now, if you talk about the reproductive age, now because of the social media and because of the too much hand mobile use and everything, people are getting aware of the symptoms and everything. But yes, if we do keep a session where we can ask about any hormonal imbalance, or maybe about the PCOS or PCOS or any kind of pills they are taking, a very simple question, okay, whether your periods are regular. Okay, if you make this question very common, okay, in the history without hesitating to ask whether it is a male optometrist or female optometrist. So this will clear most of the pathway. Yes, people will, and slowly, because still in India, the period is considered as a stigma. Okay, but if you try to ask it, so maybe the change we can bring.
Thank you, ma'am. So moving on to the next question, Jaden is asking, do you think these changes are, reversible if the systemic condition is managed?
Yes, yes, these changes are, because if you see if anything happening with the tears, so there are so many alteration which is happening. We can simply tell patient, okay, so suppose she is a computer user as well as suffering from PCOS. Okay, so first thing we have to do, we have to refer them to a gynecologist. Okay, whatever treatment they are going on. Okay, and after this, after 3 months or 6 months, when they are coming to you, you will see a surely difference. Their OSDI score will reduce. Similarly, at the same time, if they are on they are taking a healthy diet also, because PCOS is not just endocrine disorder. It can just reduce your BMI level, and PCOS can come to a normal stage also. And as soon as the PCOS is reversible, at the same time, your all ocular manifestation, your thickness, and everything is reversible.
Thank you, ma'am. So Ashwin is asking, like, does ocular manifestation vary with the different types of PCOS, like pill-induced or insulin-resistant?
Yes, yes. So that very good question again, Ashwini. So what we have seen during our cases, okay, when we were doing this research, okay, we were have taken at least minimum 3 months of the sonography report, not later than that, because we need to see कि what is the you can say the stage of PCOS level on this. So we have seen कि the person who was having a grade 3 or grade 4 of PCOS, or maybe the all three signs are present, or maybe more than, as you were seeing in my slide, the polycystic ovaries, maybe multiple cysts, more than 12 or maybe 25 or 30 things. The symptomatically patients were more aggressive as compared to a person who was having less than 15 or 13 polycystic ovaries. At the same time, see, you will not be able to see this symptom. As I was explaining, okay, you will see a facial hair or something. But initially, the basic symptoms, if you try to ask a young woman of 18, 19 years, they will tell you one thing, कि yes, periods are normal, okay, but they come sometimes in 30 days, sometimes in 45 days. Okay, so this is your trigger point. Okay, so in those patients, maybe you will not be able to see your tear film getting affected so much. But at the person who is 25 or 28, or maybe a person who is planning to go for a planning a family in future, the tear film issues will go on increasing. Okay, so it just go or they are directly proportional to each other. So if it is the disease is on the longer stage, at the same time, if the disease is, you can say patient is not taking care of, that you will see a more symptomatically different. At the same time, the ocular changes will be much on the higher side as compared to a person who have just started or maybe on the early stage of the disease.
Yes. Thank you, ma'am. So I think if there are any other questions, you can please put it in the chat box, or you can turn on your mic and ask your questions. So while we wait for that, ma'am, just one last question from my end. How do you think this has been, moved to the clinic? We understand the evidence, it's, all good, and you've said what are the points to be considered when we're looking at a patient. But how do you think is the uptake of, these findings into the clinic in your, day-to-day practice?
So for that reason, see, first thing, if we try to create awareness among young women, okay, how healthy or how important it is to get your eye tested on a timely basis. Okay, the four and most important. For this reason, what we can do as we celebrate on 8th March, the Women's Day and everything. Okay, if we can do more of social media awareness, especially in a young college student, because the disease and everything doesn't start randomly at the age of 25, 30, because now, because of a lifestyle, okay, because of the eating habit, because of the most of the people, see now, of course, we don't do body shaming and everything, but yes, we have to understand okay, BMI is going on increasing and it do affect your overall. So if suppose you are seeing a person in your clinic or maybe in your vicinity, or if somebody who is here from the university level, if they can create some kind of social media awareness or a public eye care awareness, then we have to talk about all these things also. Yes, PCOS is something which you cannot ignore, and it is not just about your period, it is about your eye and your overall health of the body also. You can keep some brochures and everything. You can create an awareness program for the especially the college going student, especially IT people. Maybe you can say a person who is working in a IT company and sitting in a place for more than 9 to 10 hours continuously. Okay, we talk about every time computer vision syndrome. Okay, but if we just talk about how important it is to have a healthy lifestyle. Okay, so just to create a small social media awareness, and the person is coming to your clinic for a contact lenses, and you just do a normal basic keratometry or you do a basic slit lamp examination, then most of the doors will be open. How much healthy is their eye, and then we can just show them the path where to go and how to proceed with it. So creating awareness is the foremost important point here.
Very nice. So yes, I don't see any other questions right now, and
It's okay. If they have any question, they can email
yes,
me. Okay. And they can write to you or they can write to OCI, and then we can answer these questions on the personal level also. But I hope this
yes,
session will create some kind of an awareness. And the young optometrists,
definitely, yes.
yes, and the young optometrists who are listening to this talk, or maybe when it is available on the YouTube, I would request you all to observe your patient. Okay. And the second foremost important thing, to take a proper history. Just don't be in a hurry, in a rush. If you have to finish this patient, if you take a proper history, then you can help a patient who is not aware of what they are going to go through in future. So if you just give them a early signs and symptoms, then they will be aware that yes, they have to be little cautious, or maybe they are trying to they're trying to look for it. Okay, how we can go ahead and just reduce the symptom, or maybe how they can prevent in future.
Absolutely. So, yes, thank you so much, ma'am. Like from your clinical expertise and from your research, you've given so much insights for all of us, to think about.
Yes.
And as we come to the end of today's session, I would like to extend our sincere gratitude to you, ma'am, for delivering such an informative and engaging talk on the topic. And I believe this session has highlighted, the importance of recognizing these implications in the first place, especially to
Correct.
those affecting women, and has definitely reinforced the need for more integrated approach to patient care. I think that is what we are looking forward to. And
Correct.
your insights have, certainly enhanced our understanding definitely, and will also help us in better diagnosing the managing the disease in our clinical practice.
Sure.
So, and once again, I thank you all the participants for joining today with us and actively engaging in today's webinar as part of the Women's Eye Health Month. Your continued interest and participation plays a vital role in strengthening our professional community. And on behalf of Optometry Confederation of India, thank you once again for being part of this session. And we look forward to having you all in our upcoming educational initiatives as well. So thank you and have a great day.
Yes. Thank you so much, Shweta. Thank you for this opportunity. Thank you so much. I leave the meeting, Shweta. Thank you.
Yes, ma'am. Thank you.